This second supplemental video will provide additional information for employers, healthcare providers, and group insurers regarding this healthcare proposal. The Medical Clearing Corporation. To transmit payments from employers to insurance groups, from non-wage individuals to insurance groups, from insurance groups to healthcare providers, as well as information and documentation from the healthcare provider to the group insurers representatives, a medical clearing corporation would be established. All individuals, employers, health insurance groups, and healthcare providers would have their own unique identifying number or alphanumeric identifier. Individuals could possibly use their social security numbers. Transmission of employee and employer premiums. Just as an employer's payroll department or payroll service withholds Social Security and Medicare taxes from an employee's pay and then matches those amounts by the equivalent employer's contribution, and just as the employee and the employer's totals are transmitted to the IRS by the same payroll department or payroll service, so will the insurance assessment of 3.95% of the employee's pay withheld from the employee and 3.95% of that pay added by the employer be transmitted to the Medical Clearing Corporation. The MCC will then credit the applicable group insurer's account, also providing the employer and employee's identifying number to that group and the amount of the assessment. In addition, any premiums due for other income earned by fully waged employees would be forwarded directly to the MCC or through the employee's bank to the MCC for allocation to the appropriate group insurer's account. Transmissions of other premiums to the MCC. Premiums determined from non-wage income, from those that are not employees, the wealthy, the self-employed, early retirees, regular retirees, laid-off workers, and former dependents over 25 years of age and still unemployed, would be transmitted through the individual's bank or directly to the MCC for allocation to the appropriate health insurance group's account. Transmission of information and documentation regarding medical procedures performed, drugs provided, and medical goods and equipment sold to the MCC. The required format for transmission and explanation for each medical service or good will be standardized so that decisions regarding whether payment is to be made to the healthcare provider can be made by the MCC. When the provider has submitted the necessary information and documentation designated by the MCC to justify the claim, the MCC will debit the group insurer's account and credit the provider's account. This method will make the MCC system similar to a single payer system. Advantages for healthcare providers. A medical clearing corporation, or MCC, would simulate a single payer system for medical care providers. The MCC will possess more interactive and user-friendly information collection software, a uniform collection system with standardized documentation requirements, immediate access to insurer payment policies, the ability of the MCC to render decisions regarding payment and directly access healthcare and insurer accounts. Hospital costs will be reduced since all U.S. citizens and legal residents entering the hospital's doors will be insured. Both federal and state governments will be completely taken out of the operational picture after a certain transitional period. In a nutshell, healthcare providers will find the collection process greatly simplified and realize a greatly reduced revenue collection period, resulting in significant savings in collection time and costs. Advantages for healthcare insurers. Besides the benefits of possible tax cuts, low-cost loans, etc., insurers would also realize, because all U.S. citizens and legal residents will belong to group healthcare plans, insurance premium revenues will increase dramatically. More advantages for healthcare insurers. Since all individuals will need to select a group insurer, those insurers will find they have a ready market for other insurance products marketed by their affiliates. Worried about future layoffs? Hey, for an extra X amount of dollars per paycheck, we will pay your health insurance premiums for the first 6 or so months after you get laid off or lose your job. Want to retire early? For an extra X amount of dollars each paycheck, you may receive a future payment of X amount of dollars per month after age whatever. Need to insure your automobile? We can give you a quote. And, if accepted, the payment will be automatically drawn from your paycheck. Need to insure your apartment or its contents, etc., etc. A final note. Will everyone be pleased with the effects of this proposal? Definitely not. But at this point in time, what are our alternatives? The proposal will hurt the least and remove our governments, both federal and state, from the healthcare funding crisis, which looms in our not-so-distant future, and provide healthcare for all. Will there be abuses under a non-governmental healthcare insurance system? Definitely. But compared to what we have now, compared to what will result if nothing is done, or compared to the abuses and gross inefficiencies that would result if a national health care plan were adopted and operated by federal and state governments, potential abuses under this proposed plan would pale in comparison. However, during the learning curve period that will occur if this proposed system is adopted, legislation might correct abuses and tweak the operational performance of the plan.